I am PV Rao. I was a former professor of endocrinology in Nizam Institute of Medical Sciences for about 25 years. I retired about 4 years. Today I will speak to you about diabetes, and this session is about what is diabetes. Diabetes, most of us know that it is one of the medical conditions which is affecting almost one third of the people, one third of the adult population in our country. It is almost like 30% of the adults above 25 years have diabetes, or at least they are going to get diabetes. Diabetes is a very common medical disorder which all of us have been knowing, and all of us have been reading about it. And diabetes is not actually a disease like an infectious disease like a typhoid or a malaria or a viral disease. But diabetes is something related to aging. It's a chronic degenerative disease. It's something related with aging. So most of us, when we are aging, we have changes in the skin. We have folds in the skin. We have a problem with the graying of the hair. We all have some sort of digestive problems. The digestion after 40th year is less than what it used to be earlier. So we tend to have some problem in digesting some of the foods. These are all parts of the aging process. So after 40 years, we tend to have some effects of aging on health, on skin, on hair, and teeth, and also on digestion. Similarly, one of the glands, that is pancreas gland, that is supposed to secrete insulin hormone from pancreas gland, is also affected. And so we have less hormone that is secreted after 40th year. So that is one reason why we get a problem with deficiency of insulin. So one of the problems with the deficiency of insulin is a hormone that is required for absorption of glucose into the cells. So glucose is the nutrient that is a major supply of energy for the entire human body. So glucose, after getting absorbed from the stomach, it has to go into the cells and all over the body. The cells in brain, cells in heart, cells in liver, cell in everywhere. So that glucose entry into the cell is facilitated by insulin hormone. So suppose if you have any problem with insulin, either the insulin hormone secretion is less, or even the insulin that is secreted normally from pancreas may not be able to be as effective as a normal insulin after some years of age. So the insulin may not be able to facilitate glucose entry into the cells as efficiently as it used to before. So that is called peripheral insulin resistance or peripheral insulin insensitivity. Or central issue is, suppose the insulin is not secreted properly or not in adequate quantities from pancreas gland, then it is called central insulin deficiency. So there are two major different types of diabetes which you come across in our populations. One is called type 2 diabetes, that is the most common diabetes which we see in almost about 80-90% of the population about 25 years age group affected with diabetes. That means people with diabetes are having either type 1 or type 2. People with diabetes, one third of the people with diabetes about 25 years, they have type 2 diabetes. That means their insulin secretion is correct, but the insulin secreted from pancreas is not effective to entry of glucose into the cells as effective as before. So that is peripheral insulin insensitivity. So insulin is not able to push the glucose into the cells. So that is called type 2 diabetes. Type 1 diabetes is not very common. So only about 10% of the diabetics are type 1 diabetics. And type 1 diabetes is basically a problem with the pancreas gland itself. So the deficiency of insulin secretion from pancreas gland causes type 1 diabetes. So there the problem is we have to replace insulin injections from outside. So that is a problem is with the injections. Every day morning and evening, twice a day, you have to take injections of insulin from outside, because the insulin that is secreted from pancreas inside the human body is not sufficient to make it effective for entry of glucose into the cells. So diabetes is basically at least remotely related to aging process. That's the most important thing which we should know. It's a condition, it's a medical condition. It's not a infectious disease. So most of the people after some 40th year, they have some problem with digestion. that is their digestive organs. Insulin is one of the hormone that is secreted by pancreas, which is our digestive hormone, digestive organ. So there is some problem with these organs. That's why we have diabetes. So diabetes is basically related to aging. It's a medical condition. It's like graying of hair, like folds on the skin, like drying of the skin. So it's also one of the medical conditions which we come across after a certain age. But unfortunately, some people tend to age earlier. So it may happen around 25th year itself. Some people by 25th year may have aging related effects on pancreas and digestion as another person after 40 years. So the aging may be premature, maybe earlier in some people. That's why diabetes is nowadays seen more commonly in people between 25 to 40 years. So earlier onset of diabetes is seen in Indian population more often than in Western population. In Western countries, diabetes usually occurs at 40th year or 35th year. But in India, it usually is noticed by 25th year itself. That's how in Indian population, the people above 25 years, almost about 1/3 of them have either already have diabetes or they are going to become diabetes. So this is a medical condition that is more commonly noticed nowadays all over the Indian population. And India is one of the major countries affected with diabetes in the world after United States and China. So we have the largest number of diabetic people. So that's why we are all devoting a lot of our information resources to people to make them aware of diabetes and to diagnose diabetes early. They should be able to know diabetes earlier so that they will be able to start treatment early, and that's how you can prevent diabetes complications in future. So diabetes is a medical condition remotely related to aging. So everybody should be aware of this issue, and all people above 25 years with or without any symptoms of diabetes should undergo a blood test at least once in a year, a simple fasting blood glucose once in a year to know whether they are diabetic or not. It will also help them to know whether they are developing diabetes in next coming 5 to 10 years. Diabetes is a medical condition related to aging mostly. I am P.V. Rao. I am a former professor and head of the Department of Endocrinology at Nizam Institute of Medical Sciences. Now I am heading a diabetes research center in Hyderabad. Today I will talk to you about treatment of diabetes. Once you are diagnosed as diabetic by any blood test, either a fasting or a 2-hour blood test, you have to start taking a medicine. It is not correct to wait for another few months for non-pharmacological therapies, because earlier we also used to tell that before starting a medication, we will do some non-pharmacological therapy like doing some exercise or losing weight, or people go for yoga or some sort of non-pharmacological therapies, that is maintaining the lifestyle changes, and try to reduce your blood glucose or try to see that whether your diabetes is under control after 3 months or 6 months. It is not proper. Nowadays we say the moment you are diagnosed as diabetic by any blood test, you have to start a medication. That's very important, along with your lifestyle changes, along with your non-pharmacological therapies like exercise and diet. You have to start medicine. That's very important, because the day you are found as diabetic, the chances of you having a irreversible complication of diabetes is very high. Especially in India, almost 50% of the Indian population who are found diabetic on the first day itself, they are known to have one of the irreversible complications of diabetes. That's very important. You have to know that, and then the first day itself you have to start treatment. And most of the situations we give them metformin tablet. Metformin is a very cheap and simple tablet known in India for last 70 years or more than 70 years. So we just start them on 250 milligrams of metformin a day and then increase it to 500 milligrams. So every weekly or twice in a week increments, we can increase the dose of metformin up to 2500 milligrams. That's almost like 5 tablets of 500 milligram each tablet, and that can be done in about 3 months time with weekly intervals, with weekly increments from 250 starting to 2500 milligrams, and see that your blood glucose comes down in fasting to to less than 125 milligrams, and at 2 hours after food less than 200 milligrams. So that is the normal value of blood glucose in fasting and 2 hours. So you should be able to achieve this kind of blood glucose in 3 months time. If you don't get that kind of a blood glucose value in 3 months time, even after reaching a 2500 milligrams dose of metformin, you have to add another medicine, the second medicine. Nowadays, most of the countries in the world, they are all advising on the second medicine as the SGLT2 inhibitors, which are very expensive. They are costing about 45 rupees each tablet. So, but nowadays all of us believe that the second line of medicine should be SGLT2 inhibitor, which is supposed to not only reduce glucose, but it is also supposed to be preventing the heart diseases which occur most commonly in diabetes. So SGLT2 inhibitors are oral tablets, and there are 3 types of inhibitors available in India. So any of them can be taken, but it costs about 45 rupees tablet. So after SGLT2, that means if you take this SGLT2 maximal doses for next 3 months and you are not able to achieve your optimal values of blood glucose, then you have to add a third medicine. Third medicine nowadays is an injection. Injections like liraglutide, semaglutide, dulaglutide, these are all called GLP receptor agonists. So these are all non-insulin injections. So a third line or even second line may be an injection like this GLP receptor agonist. So diabetes, we initially started on metformin, but as a second line we add them as a oral tablet or an injection, which is also very expensive. So this is nowadays, this is the way we treat diabetes in the first few months, and mostly the doses may have to be increased when the years pass on. During the natural course of diabetes, you may have to increase the doses of your tablets, whether you are taking metformin or SGLT2 inhibitor or an injection like GLP receptor agonist. We start with the lower doses, but you have to go on increasing because diabetes is a progressive disease. So you should not think that by adding these medicines you are able to reverse diabetes or cure diabetes. So if suppose for 1 year if you are taking 1 tablet, next year you may be requiring to take about 1.5 tablets, the third year you will take about 3 tablets, fourth year you will take about 4 tablets, like that. It's a progressive disease. So it's not really possible for us to reverse diabetes condition. So the first line, second line and third line, suppose if the third line drug is also not effective, then the fourth line drug is usually insulin injections. So there is some type 2 diabetes in elderly population or in middle-aged population also we may require to give them insulin injections. Insulin is not an injection that is given only in the children, or insulin is not the medicine that is given only in the serious conditions. So insulin is given whenever it is required, whenever it is prescribed by a doctor. So as a fourth line of medicine. In some cases insulin may also be first line in certain conditions, but basically after failing to achieve your normal target blood glucose values with metformin, SGLT2 inhibitor and GLP receptor agonist, then the fourth line is insulin injections.